Hi, all. Thanks so much for joining. Speaking of making healthcare work for you, different perspectives and empowering solutions. I'm Stephanie Fields, joined by my co-host, Dr. Apoorv Gupta. And today we're talking about our interview with Kara Hill, who is the Director of Integrated Healthcare Initiative at Greater Mental Health America of Greater Houston. And it was a really cool conversation with her because she was talking about how they're working with health systems and payers and some clinics to get integrated mental health into primary care. And so people could go see their primary care doctor. And even in, she said, the 15 or 20 minutes that you might be in a waiting room waiting for the doctor to come in, you could be seeing somebody for behavioral health issues. And she was talking about how most people, I think she said 80%, don't actually need much more mental health intervention than that. So seeing your primary care doctor once or twice a year and being able to see a behavioral health specialist at that time can really fill a lot of the gaps that we have right now with access and stigma and everything else related to mental health and substance abuse. It's really a great way to help these people and make a true impact. And it also is a way that can help alleviate the burden on primary care providers who right now might be trying to serve some of that need, but really can't. And then it's a challenge to get people to go to a separate behavioral health appointment. One statistic that she shared that I thought was really fascinating was that of people who do go see a mental health specialist and get an initial assessment, they only then see that provider one more time. And I thought that was really surprising because the people take the step and then go one more time and then stop. And I don't know what that is, but with this integrated model, you have so much less of that. Apoorv, what stood out to you about this interview?
I think in general, Stephanie, I think you and I have been talking a lot about this. Mental health, behavioral health is such a huge issue within our society, within probably globally, and within our communities, that it's so important for us to be able to feature speakers like Kara on this topic who are doing such phenomenal work at the systems level and at the physician group level and really bridging all the way across the national level. So I think that to me, I'm just personally very excited that we can continue to bring such wonderful content to our audience so they can understand the different things that are happening in this area. Otherwise, it can feel to people like it's a constant struggle. I'm really excited about this idea of integrated care. We talked a little bit about it last year when we had our speakers on the concept of collaborative care, which is a similar type of a model. Here, the notion that you can in one visit have both body and mind taken care of if you should so need it is very, very powerful. And I think all the focus that they put on training the physicians is really the right focus, because unless the primary care physician and the psychiatrist or psychologist trained physician, unless they're both comfortable with each other and what each other expect, we're never going to really be able to solve this problem. So the fact that they're bringing them together, getting them to understand each other's needs and priorities, getting them to actually accommodate each other, and then they're doing training for both so that they can understand the space within their operating. I think that that's really the right way to deliver this care. So I feel very hopeful for these kinds of initiatives. Probably the biggest challenge to all of this is something Kara also brought out, which is that we just don't have enough people trained especially in the psychiatry side. So the key is going to be for all of the primary care physicians and patients who need these services, are we ultimately in a place to provide that? So more conversations to come. I hope our audience will appreciate that, we're continuing to bring them the topics in this area that are so sensitive and so necessary. And hopefully all of you will tune in to our show.
Thanks so much for watching, and stay tuned for the full interview with Kara on Thursday. We'll talk to you soon. Bye-bye.
Bye-bye.